Hi everyone, I'm Calleja from Pregnancy and Me, and I'm with Shraddha Patel from Amethyst Physio, and today we're talking to Ruth Jamieson from the Modern Diabetic, and we're talking about gestational diabetes with pregnant women. So welcome to you, Ruth. Thank you for joining us today on an important subject. So I guess, your pleasure. So I guess one of the questions that I have is, how is it diagnosed?
Okay, so it's part of a routine screening that every pregnant woman nowadays goes through. So around I think it's like 24 or 28 weeks pregnant, your doctor or midwife will ask you to come in the morning fasted. So you're allowed to have water, but no coffee, no tea, no breakfast. And you'll be asked to drink a sugary drink. When I was pregnant 10 years ago, I had to buy a bottle of Lucozade and drink just a certain amount of Lucozade. And then I had to go sit in the waiting room for an hour, and then I had to provide a urine sample. Okay. And what they're looking for in that urine sample is glucose. And glucose is what is the end product that you get from sugar, from carbohydrates, so your starchy things like your beans and your pasta and your bread and your vegetables and your fruit. It gets broken down in your body into glucose, and eventually it gets put into the cells in your body for energy, okay? Now, if you have a problem with the metabolism of this glucose, it will not get into the body cells, and you will find traces of it in your urine. So this is what they're looking for. So if they find that there is glucose in this, you then get sent for further testing, and they do a blood test. And with this blood test, they will then confirm whether there's a problem, and they can also see the severity of the problem. So again, you will go in the morning fasted. They'll take a blood sample. They want to see what your blood sugar, your glucose is first thing in the morning without eating. They will give you like a gloopy, sugary solution. And then I think it was like 2 hours later, they take another blood sample. So again, what they're looking for is the body's ability to take that glucose and whether it manages to go into the cells or whether it can't. And you need insulin for this. So insulin is the hormone secreted by the pancreas. Right. And it's one of insulin's jobs to take that glucose and put it into the cells where it's kind of converted into energy. So if these tests come back elevated, there's certain reference ranges, but the idea is that after any high sugary or carby thing that you ingest, your blood sugar should go back to more or less where it was before. And in gestational diabetes or any diabetes, that doesn't happen so well. And so, yeah, if this comes back elevated, then you will get the diagnosis of gestational diabetes.
Right. And so I guess what causes it? What are the causes of that?
Okay, so for the most part, it's actually quite interesting because it's part of a natural phenomenon. So every woman, when she's pregnant, develops a certain level of what's called insulin resistance. And the best way to describe insulin resistance is, like I was saying before, insulin's job is to take the glucose in the blood and put it into the cells for energy. But when someone gets insulin resistance, it's like those cells are kind of going, la, 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 I don't want to take any more glucose in, I don't want any more energy. And so they resist that. Right. And so what happens is, depending on how strong that insulin resistance is, like some of the glucose doesn't go in. And so it ends up in the bloodstream, and you have high blood sugar, and your body then produces more insulin to try and deal with that, because there's only your body likes to keep 5 grams, which is like a teaspoon of glucose in your body at any one time. when it gets higher than that, it's toxic to the blood vessels and to the organs. So your body wants to take it out of the blood, and when you have too much, it gets stored like as glycogen. But yeah, in insulin resistance, the cells stop responding, and we don't really know we don't fully understand the purpose that this happens in women with gestation, with diabetes. But with gestational diabetes, I think the problem is that they already have some insulin resistance, which is what commonly drives type 2 diabetes. They already have some issues already, and then when this natural phenomenon comes in, it just exacerbates it and makes it even worse. And so this is why these women then need something to help them with their high blood sugar. So it's usually these people already have some underlying issues with glucose metabolism and some insulin resistance, and it's more common in certain ethnic groups. So I think, was it like South Asian and African and Caribbean and all of that tends to be more common in those people.
Sorry, Shraddha, you had something you wanted to ask.
Yeah. I was just wondering that, so you're saying it could be possible that before pregnancy, this woman may have like kind of borderline issue, but no one would go just to doctor, like, you wouldn't know if it's very, at minimal level. And then during the pregnancy, you just happen to have that test. And I remember the test you're talking where they ask you to, drink sugar reading. So it could be just happen that, it gets detected, isn't it?
Exactly. I mean, they say that there is a very high percentage of people who have insulin resistance that don't know about it. Whoa. Just because of our modern diets and lifestyles.
Yes.
So what are some of the symptoms, Ruth? So how do you know that you might be suffering from it, or you won't until you do these tests?
Usually you won't, but I would say, though, if you are overweight, there's an increased chance that you've already got some insulin resistance, like you would, and if usually there's not, I would say, so if somebody was becoming diabetic, they might urinate often, but as a pregnant woman, you're urinating often anyway, so you miss that. So usually the kind of insulin resistance and that isn't severe enough that you would get any of the other sort of stronger symptoms that somebody with full-blown like diabetes would have, which would normally be hunger and thirst and urination. Right. You wouldn't really see that. So most women don't really have any symptoms.
And so how common is that in pregnant women?
It is, I think it's becoming more and more common. I was trying to look up statistics. I was trying to find a nice graph to kind of see how common it's become over the years. But I think when you think about it logically, how much more common type 2 diabetes is, I think it's becoming more and more common that women get gestational diabetes. So I think it's pretty common.
Right, okay. And if they wanted to reduce their risks, what could somebody do?
Okay, so first of all, if you are carrying any extra weight, like lose the weight. Being physically active. I think if you have had gestational diabetes in a previous pregnancy, or if type 2 diabetes runs in your family, you're at a much higher risk. And then I think you could probably go on a lower carb diet. It doesn't have to be like a very strictly low carb diet, but like really concentrating on just cutting out all sugars and cutting out processed foods and cutting out processed like fats. So not healthy fats. You never want to take healthy fats out of your diet because you need that for your hormones. So keeping the avocados and the olive oils and the coconut oil and the animal fats, but really getting out all of that vegetable oils and margarines and soya and canola and rapeseed oils. You want to get all of those out of your diet, and just really eating a very healthy, nutrient-dense diet and making sure that you're very physically active and you lose weight if you need to, those are really, really going to be beneficial and going to help you reduce the risk.
Right. And how would you treat it? What's the best way of treating it?
Okay, so it depends on the severity. So some women, their insulin resistance is quite mild, and usually they'll see the dietitian, and if they just cut out sugary foods and they try and be more active, and cut out processed foods and stuff like that, usually there's some people that's enough. You know, that's all they need. Then other people, they'll do that and they've still got quite high blood sugar, and then they might be given like oral medication that's used for type 2 diabetes that helps lower the blood sugar, and so they'll have to do diet and exercise and take these medications. Or sometimes in some people where it's really severe, they might actually need to, just for their pregnancies, take insulin injections to really help their body manage it, plus do diet and lifestyle. And that's the standard that doctors and dietitians will tell people. But taking medications and stuff like while you're pregnant and not actually doing more to get yourself healthy, I think isn't the best way. There's a lot of other things you can do. And I think if those simple first dietary changes don't work, you can reduce your carbs even more and go on a lower carb diet, and it's not harmful to you as a mum, and it's not harmful to your baby either, to go much lower. And so you can really control your blood sugar that way. So there is a way for most people, if they don't want to end up taking medications and things like that, they can go on a low carb diet and really help.
And is that something you're offering, Ruth, at what you do with the Modern Diabetic?
Yeah, that's what I specialize in, low carb nutrition to help all, whether it's gestational, type 1, type 2, it's one of the most powerful tools, because no matter what kind of diabetes you have, you struggle to metabolize the carbs. And reducing those carbs is one of the most powerful tools that we have.
Yeah, right. No, so that definitely sounds interesting. What about the baby? Can the baby be born with gestational diabetes?
No. So as the name kind of suggests, it's gestational, so it's only the mum gets it. However, that baby has a much greater risk of getting type 2 diabetes in later life, because in the womb, that baby, if the diabetes isn't well controlled, is getting exposed to much higher levels of insulin and glucose. So first of all, that baby, what they really worry about with gestational diabetes, if you don't get it under control, is that baby gets far too big and then has to be born through cesarean rather than vaginal birth.
Right.
But yeah, that baby then becomes much more susceptible to develop type 2 if the mum doesn't have her blood sugar under control. And also, if that child then has a sedentary life and bad diets and everything like that, that risk is increased even more. Right.
And so is it for life for the mother?
So it's 50-50. So 50% of women who have gestational diabetes, gestational diabetes isn't for life. It usually goes away straight after birth.
Right.
But 50% of those women do go on to develop type 2. Because as I said in the beginning, there's already some insulin resistance and it's a metabolic kind of disease that's already brewing under the surface, and it's kind of being brought up. So I think, if you get gestational diabetes, it's a really big warning sign, I think, for you to kind of go, oh, there's something going on here, and I need to make permanent changes to my diet and lifestyle so that I can be healthy and avoid getting type 2 down the line. So I think it's like 50% of them at about 5 years post-delivery develop type 2 diabetes. But it can be prevented, so it doesn't have to be that way.
Right, and that's following a strict low carbohydrate diet. Is that what you recommend?
Yeah, I mean, it kind of depends. Some people, they need to go strict. Other people, you know, maybe even just going on a paleo diet that takes out some of the highest carbs, you know, all the grains and all of that, and just really watching our sugar. I mean, if you think about it, if the body only likes to have 5 grams, a teaspoon of sugar floating through it, and you look at how much extra sugar is added to so many processed foods and everything like that, our bodies weren't built for that at all. Yeah.
And
that's
so,
a lot, hey? 50% is a big number. 50%, yeah. And I actually know, including my mother-in-law, who had the gestational diabetes, and after delivery, I think 7 years onwards, she had actual diabetes type 2. This was like years back, and so much has changed already.
Yeah, we know so much more now. And so after the birth, how often should women check for diabetes?
Okay. So usually, I mean, this is what happened to me, and I think I can't imagine much has changed in those 10 years because things take a long time. I was told to just test my blood sugar for a few days on my blood sugar meter, just to see that things went back to normal. And then I was told to come back once every 6 months initially for them to test my fasting blood sugar, so that they were kind of monitoring me. And so they will ask you to come back every 6 months to monitor. And if they notice that fasting level starts to rise, then it's kind of tells them that, you know, that person's going on to develop type 2. So that's how they monitor it.
Oh, right. And so is this why you decided to open your own business called the Modern Diabetic? Was this what led you?
Well, I actually have type 1, and so, you know, most people who get gestational diabetes, it's kind of related to type 2, and they might go on to get type 2, whereas for me, that wasn't the case. So type 1 is different in that it's an autoimmune disease. So it's not that my body has gone, I don't want to take any more glucose into the insulin. It's that my immune system has destroyed the cells that make the insulin, so I don't have enough insulin. And so when I was diagnosed, this process had already started, and so I was maybe probably at 75% capacity, and then with that little bit of extra insulin resistance from the pregnancy, it kind of alerted that something was wrong. And I was very lucky, like that my diabetes care team were on the ball, because they looked at me and I was very slim. I was eating quite a healthy diet and I needed insulin. My blood sugar was so high. They were like, I got a call and they said, come down right now. And they were showing me in the office how to inject myself and everything. I was like, what's going on? And when I told them that my father had type 1, they sent me for further testing, and they tested for antibodies. And my antibodies came back positive. So for me, it kind of picked up many years before that I was like a type 1 in the making.
Right.
And so, yeah, I then decided to start doing what I do because, you know, I studied nutrition and functional medicine, and I was then thinking about what to specialize in, and it kind of made sense because this is my life and this is what I learn a lot about, and it's also just really great to work. You know, when I first realized that I had type 1, I really wanted to find someone to work with that had type 1 so they understood, you know?
Yes, exactly.
You don't hear that often, actually. Yeah.
Yeah.
No,
just
it's
one more
definitely an interesting subject.
Yeah, I just want to ask Ruth, do you do online consultations?
I do only online consultation. Yeah, only.
Okay, only. Oh, great. Yes.
I guess what we should say is that Ruth's in Portugal. Is that right?
Yeah.
Okay. Awesome.
I'm in Portugal, so it's really hot and it's morning.
Yeah.
But I have a virtual practice. I have a lot of clients in the UK, but I can see
So
anybody.
yeah, no, that's good to know, because I do get a lot of pregnant women. They come for their back pain and stuff, but that would be lovely if they can get some, a real guidance around the whole diet thing. And yeah, you seem to have a lot of.
Definitely.
I think we should do another meetup for the diet. I was really
Oh, yeah.
interested in what you were talking about, the good fats and
Yeah, there's a lot to talk about there.
Yeah, I think we should do another one, as well as understanding type 1 and type 2 and what the differences are during pregnancy as well. So, yeah, definitely want to speak to Ruth again. And Ruth, what's your website address again?
So it's www.moderndiabetics.com.
Great. Okay, so if anyone else has any other information they'd like to know, they can certainly contact you and you can talk to them about it.
Yeah, definitely.
Great. Okay, thank you. Thank you for joining us. This has been really a great session.
You're welcome. Have a good evening.
Yeah, thank you, and good morning to you. Have a good day. And I guess anyone else that's listening, it'll be great to know how you're handling your diabetes or gestational diabetes, or if you have any questions that you wanted to ask the group, just comment, like, or share, and we can certainly help out. So again, you've been watching Calleja from Pregnancy and Me, Shraddha Patel from Amethyst Physio, and Ruth Jamieson from the Modern Diabetic. So thanks everyone. Thanks for joining.
Thank you.
Bye.
Bye.